Welcome to the third trimester. Hi, my name is Daniela and I'm a licensed therapist. I make videos about therapy, sometimes about fun and travel, and now about pregnancy because this is what's going on in my life. I wanted to wait and do this video after I have gone through every step of my third trimester, but honestly I feel like after that I'm going to be too obsessed with the newborn stuff to want to talk about pregnancy. Right now it's fresh, I'm 37 weeks pregnant. I think I've gone through all of the symptoms there are to happen in the third trimester, so I feel ready to share with you. And as I've done in previous videos, so the video about the first trimester and the second trimester, in this video I'm going to focus on symptoms of the third trimester and tips that can help those symptoms. Just so you know, these tips are based on things that I have read, things that I have researched, things that have served me, things that have been recommended by my medical provider. But disclaimer, I am not a medical provider. So before you do anything that I recommend in this video, please check in with your medical provider. Nonetheless, I will provide you some mental health tips that can help you to cope with your symptoms. And by the way, if you're into mental health and you want to stay tuned with mental health content, go ahead and subscribe to my channel and give me a thumbs up so I can continue to make videos like this. But let's get on topic. Starting with some preliminary information on the third trimester. The third trimester goes from week 27 to the end of pregnancy, which for some people that can be 38 weeks, 40 weeks, 42 weeks, and hopefully no more than that. At that point, your doctor will try to induce your pregnancy. It's not super safe to go over 42 weeks pregnant. Even 42 is already not super ideal, but it happens. However, there's an exception to this prolonged pregnancies, and that is if you have a scheduled C-section or if you decide to have a medical induction. That means that your provider is going to induce your birth at a certain date and time. But if you're trying to have a natural/vaginal birth, which is what I'm striving for, keep in mind that although you have a due date, it's not going to always go as planned. It may happen before that due date or after that due date. My recommendation is not to get attached to any days and take it day by day. I read a research study that said that only about 5% of babies are born on their due date. That's a really small number, so don't get any sentimental attachment to the due date. And first mental health tip, the mindset that helps me the most to cope with this uncertainty about when I'm going to give birth and when everything's going to happen and when all these symptoms are going to be over is to stay present and grateful about the present moment. So I think of what are things that I have right now that I may not have in the future that I want to appreciate. For example, living in a house where it's only my husband and I, and there's silence and there's peace and there's freedom. Not that I'm not gonna want what comes with a baby, but this is probably the last time I'm going to have this environment and I want to appreciate it and be grateful for it. So that helps me stay present with the everyday instead of future tripping and being so anxious to have the baby now. But well, let's talk about the most interesting part, the symptoms. The longest list is a list of physical symptoms, so let's begin with that one. One of the first symptoms that I experienced that, made me realize that I was far ahead in my pregnancy was rib pain. This happens because your baby has less space and he begins to test the boundaries of your uterus. Rib pain has made me cry and leave me without breath. It's really uncomfortable and scary while it's happening. However, it's temporary and there are things that you can do about it. Something that I found very helpful is to stand up and put your arms up high. That stretches you. It gives you a really good stretch in your stomach, therefore more space for the baby to kind of rearrange and find a more comfortable position that's not about pushing your ribs with their feet or their hands or whatever they're doing. Lightning crotch. This one was really hard for me to explain when it started to happen. I would maybe scream out of nowhere and people around me were like, what's going on? And I would be like, I can't explain. The best description that I found online is that lightning crotch is a sharp, sudden pain throughout your vagina or pelvic region. So it's pretty sudden, it's intense, but it's fast, okay? It's just going to probably make you like jump a little bit or scream, but it's all good. It's a very good and healthy sign of pregnancy because it means that your baby is larger and is moving down your pelvis. There is nothing you can do about it other than tell people that you're okay and just keep going with your day. Shortness of breath. It's happened to me throughout all of the trimesters. Sometimes it happens to some women only on their third trimester. I don't know if some people are free from it completely, but it's likely to happen, especially on this third trimester when all of your organs are squished and they have less space. Something that helps me is to do breathing exercises, and yeah, just you get used to it. Trouble sleeping. This has happened on and off throughout my pregnancy. It's annoying. It's not to the point that I'm sleep deprived or that I'm, concerned about having insomnia, but as you get bigger and bigger, your trouble with sleep gets bigger and bigger, just because there are so many different things that interfere with sleep. For example, trips to the bathroom, back pain, leg cramps, not finding the comfortable position, hating what you're wearing and feeling so uncomfortable in your pajamas, your underwear everywhere. Sweats, night sweats are a big thing as well. And then on the third trimester specifically, I've been experiencing a lot of brain or thought activity at night. So I may wake up at 4 in the morning with this intense worry about something that's going to happen tomorrow, or something that has nothing to do with what I'm living in my life. It's really strange, but there are these vivid thoughts and anxiety, and also very vivid dreams sometimes. I've been reading that it's hormonal. Your hormones are more active at night. Also, your digestion is now more delayed, causing more activity in your internal system. So those two things may be playing a role and making me feel more anxious at night. Something that saves me every time is a meditation. What I've been doing is that I first ask myself, what do I need? I try to talk to myself, okay, I need to go to the bathroom, I need water, I need to blow my nose. Sometimes I get congested at night too. And I need to do these things. After I do them, I try to do some breathing exercises in bed on my own. That usually doesn't lead me to sleep, but it calms me down. And once I'm calmed down, I put in a meditation and then I fall back asleep. The whole process takes me an hour, but I've noticed that when I don't do these steps, then it takes me more than an hour. So that's my recommendation for you if you're having trouble sleeping. Next, and something I already mentioned, overall discomfort. My clothes doesn't fit. Not even the maternity clothes that I bought. So yes, sometimes I am struggling throughout the day or throughout the night because I'm feeling uncomfortable. And I don't know, I get really irritable until I realize that I'm just feeling uncomfortable in my clothing. So then I change and put on something loose, or I take off all of my clothes and just lay in bed with a blanket until I feel comfortable again. Stomach problems. Unlike other women, I haven't had a lot of stomach problems throughout my pregnancy. I know many people complain about nausea on the first trimester and sometimes again on the third trimester. They also complain about heartburn, constipation, diarrhea, all of these things. I have experienced on the third trimester more stomach problems than in previous trimesters though. I've been struggling way more with heartburn. Some people say it's because your baby is coming very hairy, so that's why you have a lot of heartburn. I don't know if that's true. Medical resources tell you that it's because, again, your stomach and all of your organs in there are with less space, and therefore you have more symptoms. For heartburn, I have no tips. I do nothing. I don't take any medication. The only thing I may do is have ginger tea or yogurt, Greek yogurt, and that does relieve the symptoms for a little bit, but sometimes it still comes back. I just deal with it like a woman. And then later on the third trimester, so starting, I want to say like on week 35, I've been struggling with different stools. So my stools are darker and they're more watery and weird. They're different, definitely different to what I'm used to. And that I have been reading that it's a symptom of labor is coming. It's not early labor, it just means that labor is coming. Pelvic pressure. As the baby gets bigger and prepares for delivery, you may feel increased pressure and discomfort in the pelvic area. Make sure you exercise every day using the medical ball. Laying down on your left side also helps, and there are also support belts that you can use or tape. I haven't used those, but some people claim that they're great. Something that has helped me personally is doing pelvic floor or perineal massages. I go to a pelvic floor specialist who has taught my partner how to do these massages on me, so he does that. I try to do them when I can. Getting too big to do it, but yeah, I try to do that, and that really helps relax that area. Oh, and something else that I am not sure if it helps 100%, but it's something I'm doing that everyone recommends, is drinking raspberry leaf tea and 5 dates a day. Braxton hicks contractions. These are practically contractions that help prepare your uterus for labor. They are a good thing, but it doesn't mean that you're in labor. Some people even call them fake contractions. They feel like a really, really bad cramp. It's sudden, it lasts for a few seconds, and they're not necessarily followed by more contractions, right? Because it's just like one time thing, or maybe 2 in a row that you'll get and then they go away. Again, this doesn't mean you're in labor, so don't get scared. It's just something that's kind of preparing you and telling your body, this is what you're gonna feel, but maybe 3 times worse when you're having contractions or when you're in labor. To manage them, just breathe through them, do whatever you have read you should do during real contractions. It helps me to think about it like that, like, okay, this is what I'm gonna feel and this is how I'm going to serve that weight. In regards to weight gain, I made a video about body image and weight gain. You can check it out if you're interested, if you're struggling with it. By this time on the 3rd trimester, you have gained significant weight already. Probably a weight that you've never had before in your life, and your body maybe looks different, you know, than what you've seen before. If you're struggling with body image problems, I recommend you watch that video. I think that at this point for me, things have gotten better. In regards to problems with body image, I have accepted that this is what it is and that there's a baby inside of here and that it needs that space for it to grow and to be a healthy baby. But at this point, I have gained about 30 pounds. I could still go 5 pounds more until my pregnancy ends, but I think my weight gain has slowed down this trimester, which is also normal. I think that your weight may just stay stable the last few weeks or kind of drop a little bit. It doesn't mean anything bad. Your baby is still gaining weight. It's just that, I don't know, maybe this is your limit. And then also I'm experiencing that if I eat to fullness, then I feel really uncomfortable. So I've been maybe moderating my food a little more and focusing on liquids like smoothies and things like that. My tip for you is, I know it's hard, I know you feel heavy, I know you feel uncomfortable, but it's almost over. Sexual related symptoms. By this trimester, I think the struggle gets real. The positions become really limited. It's just so uncomfortable sometimes to have sex and feel your baby move. I don't know how to explain it. I don't know if you feel this way. I can't concentrate. It's really hard to get to an orgasmic state when I am thinking of like, oh, he's here, he's moving here, now he's moving there. Then something else I've experienced is that everything down there is kind of swollen and a bit tight. I don't know if it's because we have this fear of like, oh my God, something's entering the canal and I'm scared. I have thought about that, but I don't know if that's all of what's happening. My doctor told me you're definitely more swollen there, so everything must feel tighter. So the combination of a baby moving, an uncomfortable position overall, and feeling really tight down there makes the whole experience uncomfortable. Nonetheless, sex is very important on the 3rd trimester. The semen has great properties that help soften up the pelvis and all that area. And then oxytocin that you may release if you get to orgasm, it's great for this phase of your pregnancy. And then the contact with your partner, of course, the relationship needs it. So I believe it's really important to make the effort and go through the discomfort, but just know it's not going to be super pleasant. Things that I've found helpful include the perineal massage before sex, using lubricants, and having your partner be as slow and gentle as possible. Another medical/physical symptom is the immune system. I have had a very healthy pregnancy, never getting sick, feeling really great. However, around week 35, my immune system began to drop a little bit and I started to have low iron, which I think is leading to anemia diagnosis. It's not super clear. My doctor here in Spain has not really talked about it enough, but that's another story. But what I wanted to say is that yes, my immune system has declined. I have gotten sick a little more and felt weaker. So I'm trying really hard to up my iron intakes. And some friends that are doctors have told me that it's really common to have a drop on your iron during this trimester. So if you are early on your third trimester, make sure that you speak with your provider and that you prepare for this trimester in terms of maybe doing more of an iron supplement or have yourself eat more red meat and beetroot, etc. Final physical symptom, which is a positive one, my hair has grown more than ever, my skin is glowing, and those two things are great. Now, psychological, emotional / hormonal symptoms. In this channel, we've talked about hormones a lot. I'm not sure how they are hitting you, but they have hit me really hard. And it's been a whole roller coaster, honestly. I think the first trimester, I was really emotional, sentimental, but normal, like it was manageable. The second trimester, I was a bit more easily irritated. I would be a little feisty and definitely, yeah. And the third trimester, it just got really, really heavy emotional. I have gone days crying and crying and crying and finding excuses to cry, I think. It's strange because most days are good, but if I have one reason to be sad, then it gets extremely overwhelming. Mental health tips, sunlight. I'm telling you, this is the best medication you can get. Go outside, get sunlight, try to see things that you like when you go outside, try to have a mindful walk. Also try to do things that bring you joy. But definitely going outside, even if you're tired, even if you don't want to get dressed, it's going to help. Now, if you're experiencing depression or sadness for more than 2 weeks consecutively, please make sure to speak with a therapist, a mental health provider, a psychiatrist, a doctor. Talk to someone that can help you so you can address it on time, because remember, these symptoms can be putting you at risk of postpartum depression. I have a whole video about that if you need some help. I've also experienced nesting. This is the most organized and on top of things I've been in my whole life. Some days, even when I'm sad, I get this burst of energy where I want to clean everything, organize everything baby related, and have everything perfect. And I've accomplished it. It feels really, really good. So my tip for you is to have fun with it. Have fun creating your baby's nursery and have fun organizing. This is something that, you know, it's gonna happen maybe only when you have children. So take advantage. If it's getting too stressful though, delegate, ask for help, and that will make you feel better. Fear and anxiety. This is something that happens a lot on the third trimester to many women, just because there's so much coming up. There is preparing for labor, there's actual labor, there's hospital stuff, managing care, healthcare, which is really stressful sometimes. Then coming back home, managing family that wants to meet the baby, creating boundaries. And if you're a first-time parent, then learning how to be a good parent is really stressful. So there is a lot to fear because there's a lot of uncertainty and newness coming for you. My friends and family tell me all the time, this is going to be perfect, everything's going to be good, nature knows what it's doing, you're going to know how to do it. But I think it's important to stay informed, so do all of the research and studying you need to do to help calm your anxieties. Ask all the questions you need to ask. Second step is to organize that information. Put it somewhere so you don't forget. I think it helps me to know, like, okay, I have researched already how to breathe during labor and the information is in this document. So I can refer to it whenever I want without fearing that I forgot the information. I do believe it's okay also to trust nature and your support system and yourself. So the third step is to develop trust across the board and try to be at peace and know that you're gonna figure it out. And I'll still give you the same recommendation I gave about depression. If you are feeling that your fear and anxiety is unmanageable, it's interfering with your ability to concentrate throughout the day, to complete tasks, to get ready for your birth, for your baby, then it's time to talk to someone so you can learn how to compartmentalize and feel more confident about your birth. Let's face it, the third trimester is rough. Your body is changing rapidly and you are feeling uncomfortable, tired, anxious, maybe depressed about the upcoming delivery. Physical symptoms such as pelvic pressure, swelling, backache, and Braxton hicks contractions can make it hard to find a comfortable position, and Psychological symptoms such as anxiety and mood swings can make it really hard to feel like yourself. And I want to tell you, it's okay to feel stressed and overwhelmed during this time. I believe that lots of self-care, talking about your emotional experience with a safe person, sunlight, exercise, nourishing foods, and lots of meditations and relaxation practices can get you through the third trimester and have a positive pregnancy experience. I really hope you found this information helpful. If you have any questions, please let me know. If you have any symptoms that I didn't cover, please let me know in the comments below. I don't know if I'll be making more videos coming soon because I'm so close to the birth and I want to focus on me and my baby, but as I always say, I'll see you soon in another video. Take care.